Hello, my friend. Pause. It is a pleasure to have you here with me today. Please sit down and make yourself comfortable. Sighs. Today, I want to talk to you about a subject that many people avoid, but in my experience as a doctor, it is one of the most vital conversations we can ever have. We are going to talk about colon cancer. Curious. Now, I know what you are thinking. Doctor, I feel fine. Why should I worry about this right now? That is exactly the trap. Colon cancer is a silent enemy and honestly, a bit of a backstabber. It is one of the most devastating cancers out there, but here is the paradox. It is also one of the most preventable if we catch it early. If we wait for the symptoms to start screaming, the battle is often already half lost. Did you know that the rates of this disease are rising at an alarming pace? And it is not just among those of us who have passed 50 or 60. In people under the age of 55, cases have doubled in recent decades. Today, it is the #1 cause of cancer death in people aged 20 to 49. But for us, the risk is real and ongoing. Think of your body like a house you have lived in for decades. Some parts start to need maintenance, right? Colon cancer usually starts as a small, unwanted tenant, a benign polyp. Think of it like a small leak in a wall. If you find it early, it is a simple fix and everything goes back to normal. But if you ignore it, that leak rots the very structure of the home. If we find this cancer while it is still localized, the 5-year survival rate is 91%. That is an excellent number. But if it spreads to other organs, that chance drops to 13%. This is why I am recording this video. I want you to learn how to read the signals your body sends, even the most subtle ones. Often, a patient comes into my office and says, "Doctor, my gut has been acting a bit strange, but I figured it was just something I ate." Have you noticed your bathroom habits suddenly changing? Maybe constipation that won't go away, or frequent bouts of diarrhea. You might be thinking, "But doctor, everyone has an off day or gets backed up once in a while. That is normal, isn't it?" Yes, for a week, maybe 2, due to diet or stress. But if it lasts for more than a month, the red flag should go up. Think of your colon as a water treatment and waste system. It absorbs water and shapes what needs to come out. If there is a mass or a tumor there, it disrupts the whole process. If the tumor irritates the lining of the intestine, your body reacts by sending more water to try and clear the area, and that is where the diarrhea comes from. On the other hand, if the tumor grows enough to create a physical block, it is like a clog in a pipe. The waste has a hard time passing through, causing constipation. The most confusing sign of all is when you alternate between the two. One day you are backed up, the next day you have loose stools. This could be the tumor blocking the path intermittently. If you have noticed this bathroom roller coaster over the last few weeks, do not ignore it. Another point many men overlook is unexplained weight loss. You might even be happy at first, thinking, "I am finally losing that gut without even dieting." But be careful. Cancer is a thief of energy. Imagine your body is a bank account for nutrients. Colon cancer acts in 2 ways. First, it physically interferes with the absorption of what you eat. Second, and more cruel, it releases substances called cytokines. These substances hijack your body's signaling and redirect all the energy and nutrients to feed the growth of the tumor, instead of maintaining your muscles and organs. Cancer is literally stealing from you to grow. If the number on the scale is going down and you haven't changed a thing in your routine, we need to investigate. Now, let's talk about something that causes panic: blood in the stool. You go to the bathroom, look at the paper or the bowl, and see that reddish tint. The first thing that crosses your mind is the worst-case scenario. But then you think, oh, it must just be hemorrhoids. My dad had those. I have always been a bit sensitive there. It is true that hemorrhoids or diverticulosis, which are small pouches in the intestinal wall, are common causes of bleeding. But here is my medical advice. You should never, ever assume it is just a hemorrhoid on your own. Blood is a sign that something is broken. Could it be something simple? Yes. But it could be the tumor bleeding. Do not gamble with your life, and pay attention to the color. If the blood is bright red, it usually comes from the end of the tract. But what if the stools are dark, almost black, like coffee grounds? Many patients think this is just something they ate, like beets or iron supplements. However, black stools mean blood that has already been digested. Imagine blood coming from a wound at the beginning of your large intestine, or even in your stomach. As it travels through your entire digestive system, it interacts with acids and chemicals, changing color from red to black. This can indicate a problem on the right side of your abdomen, in the ascending colon. It is a bleed that is higher up and often older. This leads us to an even more subtle sign, which we often only find in routine blood tests: iron deficiency anemia. You feel tired, out of energy, maybe a bit pale. You think, old age is catching up to me, doctor. I am just getting slow. But let me explain what is happening inside. A tumor might not cause a scary, visible bleed. It can be a tiny, slow leak, drop by drop, for months. Your body uses iron to build hemoglobin, which carries oxygen in your blood. If you have this constant leak, your iron reserves run dry. For a woman who is still menstruating, anemia makes sense. But for a man of our age, iron deficiency anemia is colon cancer until proven otherwise. It is your body telling you there is a silent leak somewhere in the plumbing. Another sensation my patients describe is something we call tenesmus. It is that feeling that, even after using the bathroom, you are not finished. You feel like there is still something in there, a constant pressure. Many men think it is just irritable bowel or trapped gas. What is happening is that the tumor, especially if it is in the lower part of the colon or the rectum, tricks the nerves in that area. It presses against the intestinal wall, mimicking the feeling of stool ready to exit. Your brain gets the signal to go, but there is nothing to come out, only the tumor taking up space. If this feeling lasts for weeks, it is a red alert. Speaking of gas, let's talk about abdominal bloating. You might think, doctor, I have had gas since my 30s. This can't be cancer. I hear you. But if the bloating is new or has become much more frequent, listen up. There are 3 reasons for this in colon cancer. First, the physical blockage. Gas gets trapped behind the tumor mass, like traffic backed up behind a highway accident. Second, the tumor disrupts the normal fermentation of food, messing with your healthy bacteria, your microbiome. And third, when the flow slows down because of the tumor, bacteria have more time to ferment the food, which produces even more gas. If your belly feels like a balloon and it doesn't get better with diet changes, it isn't just the beans you had for lunch. Now, I need to be very honest with you. Do you know what the most common early sign of colon cancer is? It is no sign at all. No one likes to hear that. But colon cancer usually only causes these problems I mentioned when it is already somewhat advanced. This is why screening, the famous checkup, is so fundamental. We want to find the problem while you still feel like $1 million. Here at the clinic, the recommendation is to start at age 45 for those with no family history. I know. You hear the word colonoscopy, and you want to change the subject. I get it. The prep the day before isn't exactly a weekend at the spa. You have to clear out your whole system, and that involves some urgent trips to the bathroom. But think of it as a preventive deep clean for your house. The colonoscopy is the gold standard because it is a 2-in-1 exam. The doctor goes in with a micro camera, examines everything, and if they find one of those polyps, that wall leak I mentioned earlier, they remove it right then and there. It is one of the few exams where the diagnosis and the treatment happen at the exact same time. You might be wondering, Doctor, what if I really do not want to do the colonoscopy? Is there another option? Yes, there are stool tests you can do at home that look for traces of blood or DNA changes. They are less invasive and don't require sedation, but they are not as accurate as a colonoscopy for detecting cancer precursors. And they need to be done much more often, every year or every 3 years. But the main point is, no matter which test you choose, just do it. If you have a family history, if a brother or a parent had colon cancer or high-risk polyps, we do not wait until 45. We start at 40 or even 10 years before the age your relative was diagnosed. If your brother found out at 35, you should start at 25. Does that make sense? My goal here is not to scare you, but to empower you. Colon cancer is a formidable opponent, but it is a slow one. It gives us windows of opportunity to act if we are paying attention. If you have noticed any of these changes in your bathroom habits, the color of your stool, your weight, or that tiredness that won't go away, do not wait until your next appointment 6 months from now. Call your doctor today. Tell them exactly what you are feeling. Taking care of your health is not a sign of weakness, my friend. It is a sign of intelligence. It is making sure you will be here to see your grandkids grow up, to enjoy your retirement, and to keep your vitality. Soon, I will record a video talking specifically about how to prevent this through diet and lifestyle, what you can put on your plate to shield your gut. So, make sure you are following my advice. Share this conversation with your friends. Sometimes, a man just needs to hear from another man, or a trusted doctor, that it is time to take care of himself. Stay alert to the signs, take care of your temple, and remember, early detection is your best suit of armor. I will see you in the next video. All the best.